If you are dealing with back pain that occurs in a pattern, especially if you are advanced in your pregnancy, and say your back pain is coming every 3 to 5 minutes and it radiates, spreading from the front to the back, you need to get examined as soon as possible, because back pain that follows a pattern can be due to contractions. And if you are not due yet, you don't want contractions. So if your back pain is in a pattern, go and get seen as soon as possible. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. Don't forget to hit the subscribe button and turn on your notification bell, because that is how you are made aware of every time I upload a video. Now, mention pregnancy, and just about any woman who has carried for any amount of time or given birth before will let you know that aches and pains are synonymous with pregnancy. If you deal with any of the pains that I'm going to cover in today's video, make sure you do not self-diagnose with this video. Instead, talk with your provider so that he or she can tailor a program or a treatment course that is best suited to your needs. Now, in today's video, I will be addressing 4 common aches and pains that a lot of pregnant women deal with. And I'm just going to jump right in and start talking about a pain known as round ligament pain. Now, for those who don't know, ligaments are little connective tissue that connects your muscle to a bone. And if you didn't know, the uterus is a muscle. So your round ligament connects your uterus to your pelvic bone. Now, before a woman gets pregnant, this line is nice and short and tight and keeps the uterus in place so that, you know, as a free floating organ, it just does not fall around in the reproductive space in the body. Now, once a woman becomes pregnant, the round ligament begins to stretch as the uterus stretches to accommodate a growing fetus. The problem with this is, as that ligament stretches, it becomes tight, it pulls thin and stretches and becomes extremely irritable. Now, round ligament pain tends to kick in the second trimester, but it can occur at any time, especially if a mom gains weight too quickly or if she is pregnant with multiple babies. Now, most women describe it as a cramping pain, but other women have also described it as a sharp and stabbing pain, as those ligaments come in contact with and is irritated by surrounding structures. And there's some things that a mom can do to help her manage round ligament pain, and they include using a warm heating pad. Make sure it's warm, not hot. You can also take a warm shower. Make sure that you are standing or sitting slowly. Just try to minimize any sharp movements that would irritate those ligaments that are already very sensitive. You can also talk with your doctor, and he or she may prescribe you something over the counter like acetaminophen, or the more popular way it's known around the world is paracetamol, so that you can help to relieve this severe pain. So make sure you rest. Make sure you are resting every chance that you get. Also, before you cough or sneeze or you laugh, make sure you bend or kind of flex a little bit at your hips so that your body can better absorb the shock from performing these activities. Also, invest in a belly band or a pregnancy belt, because the pregnant uterus gets very heavy. If you cushion it with this additional belt, then your body can better absorb the shock of just your daily activities. It is definitely encouraging for women to know that once they deliver their baby and their uterus begins to go back to its normal size, that round ligament pain tends to decrease and go away also. The next common pain that a lot of pregnant women deal with is known as sciatic nerve pain. It is also called lumbar radiculopathy, or just commonly known as sciatica. It has several causes. It can be caused by a growing woman's pregnant belly, the shape that a woman assumes as she carries her baby, the position that her baby is in, or it can also be secondary to shifts in the spinal disc just because of the increased weight of carrying a pregnant baby. Now, what happens is that a woman will be sitting or standing, usually when you're moving, and she will experience pain shooting from her buttocks all the way down the back of her knees and towards her feet. Keep in mind that nerves have a really bad attitude. When they are irritated, they tend to fire or shoot in response. Now, when I was pregnant, my second pregnancy and my third pregnancy, I had very bad sciatic nerve pain. If I just tried to get up from a sitting position, position, I would feel it shoot down my left leg. And when I tried to adjust that leg, it would shoot down my right leg. It is a very sharp, downright wicked pain. There's no other way to describe it. And it can make you lose your step and feel like you are going to fall. So it's very, very important for moms to find ways to manage this, especially if it is complicating your ability to complete your daily activities. Now, as previously suggested, it can happen on one side of your body, or like it happened for me, it can happen on both sides of a woman's body. It is typically seen in the third trimester where the uterus has grown and expanded beyond its boundaries and is putting a lot of pressure in the lumbar region of a woman's back. But it can also be seen during any time of the pregnancy, as previously mentioned, if a woman gains weight too quickly, if she is carrying multiple babies, or it also depends on how her babies are lying in her womb. There are a few things that moms can do to help them relieve sciatic nerve pain, and that includes taking a warm bath or a warm shower, using a warm compress. Just be careful that it's not hot, as previously mentioned, because you don't want to overheat your baby. Make sure that you are using a pillow when you sleep. Put it between your knees. If you are hurting on one side, make sure that you sleep on the side opposite the hurting side. If you are hurting on both sides, make sure you rotate frequently just to give each side of your body a little rest from too much compression. Some other things that a woman can do also include resting with her leg elevated, stretching, making sure she participates in light activity. You can get a massage, but make sure that the person doing your massage is a licensed professional. Make sure that you gain weight at a steady pace, because extremely rapid weight gain can lead to sciatic nerve pain that really hurts. You can also talk to your doctor about giving you something to help relieve the pain if it is very severe, and he or she can tailor something to your needs. It is definitely encouraging to know that once a mom delivers her baby and begins to have her uterus shrink back to a normal size, and some of the swelling that she experienced while she was pregnant begins to go away, that sciatic nerve pain begins to go away too. So just hang in there, mom. The third common pain that a lot of moms deal with just sort of feeds off of sciatic nerve pain, and it is back pain. Now, back pain can be caused by weight gain as a woman progresses along in her pregnancy. It can be caused by the shift in the center of gravity as a woman tries to manage the changes in posture while she develops her pregnancy. It can also be caused by hormones that relax the tendons and the ligaments in the body so that your body can successfully carry and grow a baby. Now, back pain tends to be really bad in the third trimester, but it can happen anytime during pregnancy because, as previously mentioned, hormones play a role in relaxing those tendons and ligaments. And when your body deals with relaxation in tissue that's normally tense, then it can interpret that as pain. Now, some of the things that a mom can do to help manage back pain is to maintain a proper posture. This is easier said than done, but you can use a pregnancy belt. Make sure that you are wearing supportive shoes. A lot of women love to look cute. Make sure they are dressed to wear heels. Do not do yourself an injustice and stack yourself up on 6-inch, 4-inch heels, because they will further compound back pain. Make sure that you ask for help. Avoid using your waist for too much activities. If you have to bend down and pick up something, use your hands and your knees and use proper posture to pick it up. Also, you can try massage or a warm bath. Now, I've mentioned warm bath and massage for the past 3 activities. Those 2 things are marvelous during pregnancy and should not be easily overlooked because they really can help with a lot of pains that women experience during pregnancy. Also, a woman can use a supportive maternity belt, as previously mentioned. If you lay down, make sure you are lying on your side and put a pillow between your knees. A lot of companies now make a pregnancy pillow that sort of straps around a woman in the shape of a C, just to help encourage good posture, whether you're lying down, sitting up, and then when you get up, like I said, make sure you try to maintain proper good body posture. If your back pain is severe, make sure you talk to your doctor. He or she will evaluate you to make sure that something else is not happening, such as sciatic nerve pain or, a bulging disc. And then he or she can design a program or a treatment approach that best suits your need. Now, if you are dealing with back pain that occurs in a pattern, especially if you are advanced in your pregnancy, and say your back pain is coming every 3 to 5 minutes and it radiates, spreading from the front to the back, you need to get examined as soon as possible, because back pain that follows a pattern can be due to contractions. And if you are not due yet, you don't want contractions. So if your back pain is in a pattern, go and get seen as soon as possible. Now, believe it or not, the fourth one, which is carpal tunnel syndrome, is experienced by upwards of 2 out of every 3 months during pregnancy. And it is generally caused by swelling that a woman can experience in her hands or in her fingers as she begins to enter into her 3rd trimester of pregnancy. And when a woman's hand becomes swollen, it puts pressure on the carpal tunnel, and that can lead to numbness, it can lead to tingling, it can lead to pain in the fingers, and a mom just generally finds it a very uncomfortable situation. There are some things that moms can do to help relieve this. Some include stretching exercises of the hands. Make sure you just flex your palm up and then contract it back. You can also just curl just the tips of your finger to help encourage good blood flow, good nerve activity in your fingers. Another thing that moms can do is to gently squeeze a ball. And what that does is it helps to release all of the fluids and encourage the fluids to flow back into the main circulation. It also helps to ease the tension and the tightness that occurs in the muscles and in the interstitial joints that a woman has in her hand and in her wrist. Also, if you sleep on your hand, and I know that this is something that I deal with. When I lay down, I tend to lay down on my hands like this. Try to avoid doing that, because that puts pressure and pinches down on the nerves and just kind of limits circulation in your hands and in your wrists. And when you wake up, it increases the likelihood that you will feel that tingling in your hand. Now, if you wake up and deal with tingling in your hand, you can shake your hands gently until the tingling goes away, until the sensation comes back into your hand as normal. Now, certain moms are at higher risk for carpal tunnel syndrome during their pregnancy than others. And that includes women who use their hands a lot more frequently, such as those who braid hair, women who type a lot, like teachers who write on a board. Just any activity that requires the manipulation of the hand more frequently than is usual. What you can do is make sure that you rest your hands as much as possible. If you are sitting at a computer, make sure you level your computer's chair with the desk so that your hand is sitting flat across the computer desk and that your wrist is not maintaining a poor posture for too long or a prolonged period. Now, once swelling is resolved, once the woman gives birth, some of the signs and symptoms of carpal tunnel will go away. However, if it persists, then a woman can talk with her doctor, talk with her primary care provider, so that a care plan can be developed to help her manage her carpal tunnel syndrome and the lasting effects from pregnancy. Now, if you have learned something from the content of this video, do not fail to share it with your family, your friends, or anyone you feel like they can benefit from this. Also, don't forget to hit the subscribe button and turn on your notification bell so that you join this growing community and are made aware of every time a video is uploaded. Join us as we create a growing community of empowered learners who are active advocates in their own health care. I wish you a safe, healthy, and happy pregnancy. And until the next time, be blessed.